Hello, everyone, and welcome. Today, we're talking about asthma, a common but often misunderstood condition that affects millions of people worldwide. If you've ever experienced shortness of breath, wheezing, or a tight feeling in your chest, you may have wondered whether asthma was the cause. In this video, we'll cover everything you need to know about asthma, including its causes, signs and symptoms, foods that may help, common myths and facts, healthy habits, prevention tips, and when it's time to seek medical care. Let's get started. What is asthma? Asthma is a chronic disease of the airways in the lungs. When someone has asthma, the airways become inflamed and sensitive. Certain triggers can cause these airways to narrow, swell, and produce extra mucus, making it difficult to breathe. Asthma can affect both children and adults. While there is currently no cure, it can be effectively managed with proper treatment and lifestyle changes. Causes and triggers of asthma. The exact cause of asthma isn't fully understood, but several factors can increase the risk. Common causes and risk factors: family history of asthma or allergies, exposure to tobacco smoke, air pollution, respiratory infections during childhood allergies such as dust mites, pollen, pet dander, or mold, obesity, occupational exposure to chemicals and fumes. Common asthma triggers: dust and pollen, cold air, exercise, smoke, strong perfumes or odors, stress and anxiety, respiratory infections like colds and flu, pet fur and dander. Remember, triggers vary from person to person. Signs and symptoms of asthma. Asthma symptoms may come and go, and they can range from mild to severe. Common symptoms: wheezing, a whistling sound when breathing, shortness of breath, chest tightness or pressure, persistent coughing, especially at night or early morning, difficulty exercising due to breathing problems, frequent respiratory infections, warning signs of a severe asthma attack, extreme difficulty breathing, rapid breathing, blue or gray lips and fingernails, difficulty speaking, severe chest tightness, symptoms not improving with an inhaler. A severe asthma attack is a medical emergency and requires immediate treatment. What happens during an asthma attack? Imagine your airways as small tubes carrying air to and from your lungs. During an asthma attack, the lining of the airways becomes inflamed. Muscles around the airways tighten. Extra mucus is produced. These three changes narrow the airways, reducing airflow and making breathing difficult. This is why asthma medications often focus on reducing inflammation and relaxing airway muscles. Foods that may help people with asthma. No specific food can cure asthma, but a healthy diet may help support lung health and reduce inflammation. Beneficial foods: fruits and vegetables, apples, oranges, berries, carrots, spinach, broccoli, omega-3, rich foods, salmon, sardines, tuna, flax seeds, magnesium, rich foods, almonds, pumpkin seeds, beans, whole grains, foods rich in antioxidants, tomatoes, bell peppers, leafy greens. Drink plenty of water. Staying hydrated helps keep mucus thinner and easier to clear. Foods some people may need to limit: processed foods, sugary drinks, excessive salt, foods that trigger personal allergies. Always identify any food allergies that may worsen symptoms. Myths versus facts about asthma. Myth number 1: people with asthma shouldn't exercise. Fact: regular exercise can improve lung function and overall health. Many athletes successfully compete while managing asthma. Myth number 2: asthma only affects children. Fact: adults can develop asthma at any age, even if they never had it as a child. Myth number 3: if symptoms disappear, asthma is gone. Fact: asthma is usually a lifelong condition that requires ongoing management. Myth number 4: Inhalers are addictive. Fact: asthma inhalers are not addictive. They are essential tools for controlling symptoms and preventing attacks. Myth number 5: asthma is just a minor breathing problem. Fact: severe asthma attacks can be life-threatening if not treated promptly. 5 healthy habits for people with asthma. 1. Take medications as prescribed. Follow your doctor's instructions even when you feel well. 2. Know your triggers, identify and avoid things that worsen your symptoms. 3. Stay physically active. Regular exercise strengthens the lungs and improves overall health. 4. Maintain a healthy weight. Excess weight can make asthma harder to control. 5. Get vaccinated. Annual flu vaccines and recommended vaccinations help reduce respiratory infections that can trigger asthma attacks. Prevention tips. Although asthma cannot always be prevented, attacks can often be reduced. Helpful prevention strategies. Keep your home clean and dust-free. Use allergy-proof mattress and pillow covers. Avoid smoking and secondhand smoke. Monitor air quality reports. Wear a mask when exposed to dust or pollutants. Manage stress through relaxation techniques. Follow your asthma action plan. Keep rescue inhalers available when needed. When should you seek medical care? Contact a healthcare professional if symptoms occur more frequently than usual. You wake up at night due to breathing difficulties. Your inhaler becomes less effective. Daily activities become difficult because of breathing problems. Seek emergency medical care immediately. If you are struggling to breathe, your lips or fingernails turn blue or gray, you cannot speak full sentences, your rescue inhaler provides little or no relief. Symptoms worsen rapidly. Never ignore severe asthma symptoms. Conclusion: asthma is a chronic lung condition that causes inflammation and narrowing of the airways, leading to breathing difficulties. While it cannot currently be cured, it can be successfully managed through proper medication, healthy habits, trigger avoidance, and regular medical care. By understanding your triggers, following treatment plans, eating a healthy diet, staying active, and seeking medical attention when necessary, you can live a full and active life with asthma. Thank you for watching. If you found this information helpful, remember to share it with family and friends. Awareness and education can help save lives. Stay healthy, breathe easy, and take care of your lungs.